Is sleep apnea the new silent killer? Sleep apnea causes many unnecessary deaths each year that could have been prevented. Early detection, treatment, and diagnosis are preventative measures that can help save many lives. This speech is to inform you on the topic of sleep disorder breathing, known as sleep apnea, as well as treatment options and their advantages versus disadvantages. First, let's define sleep apnea. Sleep apnea is the absence of breathing for 10 seconds or longer while sleeping. A diagnostic, also known as a baseline study, can determine if a person has sleep apnea and the severity. Working as a sleep technician for over 5 years, I know that many are seen by their physicians for symptoms such as EDS, excessive daytime sleepiness, or other sleep-related issues, to later determine that they have sleep apnea, and sleep apnea being the underlying cause or correlation with other serious health conditions. This study sought to determine in patients with heart failure whether untreated moderate to severe obstructive sleep apnea is associated with a higher mortality rate than in patients with mild to no sleep apnea. Obstructive sleep apnea is common in patients with heart failure and exposes the heart and circulation to adverse mechanical and autonomic effects. However, its effect on mortality rates of patients with heart failure has not been reported. Stated from the National Center of Biotechnology Information. Treatment options include surgery and/or CPAP. Advantages and disadvantages for surgery versus CPAP machines. Advantages of CPAP. No surgery is required. It is covered by most insurance companies. It enables users to breathe while sleeping. This is an example of what a mask will look like. It is applied to either the nose only or the mouth and the nose, and they make some that are bigger and different types of material, and it's connected to a hose and a machine. Some of the disadvantages of using this is some may find that it's uncomfortable. It can cause excessive dry mouth, and it may require high amounts of therapeutic pressure to eliminate respiratory disturbances. And surgery is also another option, and the disadvantages to surgery are that the sleep disorder issue that you're having may not be completely resolved. You can, depending on what type of obstruction that you're having, it still may not allow you to breathe the way that you need to, and still may end up using the CPAP machine after you have the surgery. It is more invasive, but the advantage is that it could possibly resolve the sleep disorder. No daily usage of CPAP, and of course, you don't have to have the discomfort or irritation by using the CPAP machine. Another alternative is oral appliance as an option to alternative to those other two, to the CPAP or surgery. In conclusion, the silent killer known as sleep apnea can be prevented. There are signs and symptoms you should listen for. For example, a person who has hypertension, diabetes, or heart disease are with sleep apnea have increased chance of mortality. With treatment and diagnosis, these type of deaths can be prevented, and also sleep apnea can be treated. And this is very successful and will reduce the mortality rate.